briefing, which we are told could be a little bit later than 11:15 Eastern today. We'll bring you up to date on that as soon as we can. Of course, the world now has surpassed 2 million cases of COVID-19, according to Johns Hopkins University, which has been tracking those statistics on a regular basis. Here in this country, the numbers remain high, but the point of focus and the area of vulnerability continues to be long-term care centers across this country, particularly outbreaks in Quebec and Ontario. And so we'll talk a little bit more about how governments are moving to try and bring in additional support for some of Canada's older Canadians in this country. Let me bring in my colleagues, Power and Politics host Vashi Kapellas and the CBC's David Cochrane now, for help with our analysis and as we wait for the Prime Minister. So we are expecting today, Vashi, that the Prime Minister will fill in some of the gaps on the Canadian Emergency Relief Benefit, because there were people that were left out, and we have seen this with the policy the government pushes out the door very quickly, that some people don't get included, and so the government goes back to try and fix those things and get those people the money.
Yeah, Rosie, the government and specifically the Prime Minister last week signaled that they would aim to do that in the coming days. And my understanding is there will be some additional details provided about that. This has largely been driven by members of the opposition as well, who have made sure to include the exclusions, if I could put it that way, in any kind of agreement they made to support, for example, the wage subsidy legislation over the weekend. They had the government, and the government was obviously very willing, considering they had signaled already, be very specific about the need to address people who were not covered by the CERB. That's the $2,000 you can access if you've lost your job due to COVID-19, if you have to stay home because you're sick, if you have to stay home to care for someone who's sick, or, for example, even if you just have to stay home to take care of your kids because schools are closed. People who traditionally hadn't already been covered include students, for example, who had expected work this summer, and though there have been some announcements geared towards students, many felt they still were missed by the government program. So students, for example, people who have lost the majority but not all of their income, or have lost all their income but anticipate some work in the future, just not enough to pay their bills. So those are the areas that I'm focused on today. The second thing I'll just quickly bring up that I'm really watching for is questions towards the Prime Minister on the WHO, the World Health Organization. Last night, President Trump announced that the United States was suspending its funding, was halting its funding of the WHO, which amounts to about $400 million. He has concerns, he says, about the reliance of the WHO, as he characterizes it, on China and the data that came out of China. Of course, various leaders around the world relied on that data, and in fact, even the president had said that China was doing a good job in late January. Obviously, the opinion of his opinion and others has changed. So I'm interested to see what the Prime Minister has to say about that action towards the WHO and how reliable he feels the information coming out of China has been and is.
Yeah, me too, for sure. Andrew Scheer was asked those very questions this morning, and he seemed to be more skeptical about the WHO, and certainly laying a lot of blame at the feet of China and the way it shared information. And there was some reporting around that this morning that did also raise eyebrows. But the president, as you rightly say, Vashi, really says that the WHO took China's information at face value, didn't ask enough questions, and is now making the connection between that and why the WHO should continue to have funding from around the world. David, this government has relied very heavily on the WHO to explain why it's making certain decisions. Our own Chief Public Health Officer is an advisory member of one of their boards at the WHO. So I'm not sure it's going to go down the same path as Donald Trump. But needless to say, there are certainly questions about how China handled the pandemic itself and what kind of information was shared.
Yeah, I don't think there's any real doubt amongst the international community that China was obfuscating, perhaps lying and completely covering up what was happening inside its own borders by now. There's a strong report by the Associated Press right now that they allowed Lunar Festival celebrations to happen in Wuhan when they were aware of human-to-human transmission and aware that there was an outbreak, and waited 6 full days before they went public with that because of the secretive nature of the Chinese regime. And this is a problem in a time that calls for great transparency, openness, and sharing of information so that people can make key decisions and institutions and other governments can respond. So the culpability that exists with China has not yet been quantified, but I think it has become evident to a lot of people. It is interesting to note, though, Rosie, that the same president of the United States who attacked the World Health Organization for relying too heavily on China yesterday and cut off their funding was in January tweeting and praising President Xi of China for his wonderful transparency and having control of the situation on the ground there. So not for the first time, there is some revisionist history being written by the official Twitter account of the President of the United States. None of that changes where we are today and how people are responding. And the sort of accountability that is happening in real time is happening as each new slice of information becomes available. It's very difficult to get a complete picture as we get this information on the fly because what we believe today on some things could change tomorrow, could change the next hour. That's just the way things have been unfolding here. But yeah, a big finger being pointed at China by the most powerful country on earth. And by a lot of critics inside this country, like Jason Kenney, like Andrew Scheer. It is a bit more challenging, I would suspect, for the Prime Minister and federal cabinet ministers to wage that sort of verbal battle with the Chinese government right now, because Canada needs personal protective equipment, and they need to get a lot of it from China. And the time for accountability for China will come. It is very difficult for the Prime Minister to come down to that podium that we're looking at right now and launch an attack on that when they're trying to get Air Canada and cargo jet planes into Shanghai to get equipment out of China to get it to the front lines of Canadian health workers. So it is a very difficult challenge for the government to manage that at this point in time.
Yeah, I will say that the UN Secretary General Antonio Guterres said yesterday it was not the time to cut funds to the WHO, that the international community should be working together to fight the virus. As Vashi pointed out, the US funds the WHO to a huge amount, $400 million. Canada is the 17th biggest donor just after China. So the world essentially pays into the WHO to help facilitate research, scientific research, development of vaccines and drugs, and very particularly plays a role in developing countries and making sure that they can contain spread of other diseases and viruses. So if that started to become an issue for many countries, and there are other countries other than the United States asking questions about the WHO, but if we got to a place where the WHO suddenly the funding fell apart, that I think would have immediate health ramifications around the world. And you know, I'm not saying the WHO is good or bad here. I'm just saying that based on the things that they have done in the past, there may be an opportunity for questions. But the consequences of pulling out of the WHO for the world, I think, would be quite deadly, to be quite honest. We've just got word that the Prime Minister is going to be a little bit late this morning. He's going to come at 11:30 Eastern, but he will certainly get questions about the WHO because primarily of Donald Trump's decision to suspend funding to the WHO for a period of 60 to 90 days to review how it has behaved or how it has dealt with China's lack of information to the World Health Organization. We are, of course, though, also expecting him to give more information, as Vashi explained there, about some of the people that felt they were left out of the emergency relief benefit. So he will make that clear, as will federal officials that will follow at a noon briefing. But I want to focus in a little bit on one of the stories we've been following you know, throughout the past couple of weeks now. It has become very clear that long-term care centers and seniors' homes in this country are being hit much harder with this virus than anywhere else. Dr. Theresa Tam saying now that half of more than 800 cases in this country are inside those centers, and that even as growth of COVID-19 starts to slow, it is not slowing inside retirement homes and long-term care centers. Moira Davis recently lost her father, and he was a resident of Maison Heron. That's the Montreal Area Long-Term Care Centre for Seniors. It is now under investigation by public health authorities and the police. And Moira is in Crichton, Saskatchewan. Moira, good to see you, and my condolences about your father.
Thank you, Rosie, and thank you for having me.
No, we're glad to have you. So why did I guess you chose to put your father in this home in Heron back in 2016. What was your impression of the place when you made that decision?
I had toured 5 other residences. My dad had been in a previous residence that wasn't meeting his needs, so I wanted to move him. And Le Heron presented to me a community. I saw residents there interacting with one another, playing games, cards, laughing, coffee, all that sort of stuff. So I thought, oh, we have a community here where he will have mental stimulation, and he'll develop relationships. And I didn't see that interaction amongst residents at the other 4 places, private ones that I had gone and toured.
So he was there for a while. And when did you start getting the sense that maybe things were not going as well as you had hoped?
Initially, we always had issues in terms of communication with respect to his medical care. But in terms of this latest COVID outbreak, I knew things were going south after I received the second email from the home on the 29th, advising me that there were 3 cases. And on the 30th, I spoke with the leasing agent there and specifically asked where the cases were and was one on my dad's floor, and she said yes. So I knew then, given what was going on in BC and Ontario.
And your dad was an older guy. He was 96, I believe. What kind of underlying health conditions did he have? Like, did he need a lot of care? Were you immediately concerned that he was going to be impacted?
I was immediately concerned. He was 96, so wanted to make 100 to get that letter from the Queen. But he did have a host of health issues. He was wheelchair bound, legally blind, he going deaf. They needed a lift to put him in and out of bed. So I became very concerned after receiving the email from the 27th when they told me that they were going to be confined to their rooms. Because I knew then that his world would be quite small, and I couldn't get information phoning and emailing to see if he ever got out of bed or was dressed or anything.
You, I think, paid additionally for some workers to come in, though, because you were out of the city, and I believe your sister is too. So you're not there hands-on. You wouldn't have been able to go in anyway. But you paid for some additional support, did you?
Yes. I live in Saskatchewan. My sister lives on the West Coast, I should say. And she made arrangements with a professional company that supports seniors to arrange for someone to come in to visit my dad 2 to 3 times a week. They would do things like just have conversations, listen to his stories, do crossword puzzles, that kind of stuff. And all as well, my dad had peripheral vascular disease and had ongoing issues with his feet. So my sister arranged for a foot care specialist to come in every few weeks to address his feet and to be able to provide her with an unbiased third-party analysis of how his feet were doing.
And what happened the last time you spoke to your dad? What was he able to tell you, or what was your sense of how he was doing?
He wasn't doing well. I phoned every day after the first email. I last spoke to him on Monday, the 6th. The conversation was very brief, 3 minutes, 20 seconds. He had great difficulty speaking. He was very weak. I could tell that his breathing was very shallow. So I did most of the talking. And at the end, as we always did, we just said we loved each other.
He was not tested for COVID-19, but you do believe that is probably what killed him.
We are unsure at this point whether or not he was tested, because we can't, again, information. We did request when we got the phone calls from the nurse and the doctor the night before that he be tested after he passed. We don't have any true clarification.
And now, of course, we know that 31 people have died in that residence, 5 of them from COVID-19. There's an investigation going on about how people were cared for. What are your thoughts now, seeing how the devastation just inside this one home?
Well, at the time when things were going south for my dad, we were completely unaware of what else had been going on in the home prior 2 weeks. When I spoke with the nurse the night before, I specifically asked if they thought he had COVID, and she basically said to me that they assumed everybody did, and that they had stopped testing. So that was after the government stepped in. So I'm completely unsure as to how that decision was made. And then after my father passed, 2 days later, reading the explosion in the Montreal Gazette and subsequently the CBC about what was going on to the home prior, my question now is, did he die of COVID-19? Did he die of neglect? Or did he die of both?
I'm just waiting for the Prime Minister, who's now going to be on time, I think, Moira. I haven't said your dad's name. What was your father's name?
Stanley.
Stanley. What would you, now that you're seeing this outbreak across the country in long-term care centres, what would you like to see from government officials or public health officials to help people like your father, Stanley, or other people that are stuck inside these homes right now? What is needed?
Oh, the whole system needs to be torn to the ground and rebuilt. You can't patchwork this anymore. This is a ship that is sinking. You need to rebuild a new ship. Because
yeah, go ahead, Moira. Sorry, go ahead.
Honestly, they talked about the home being a red zone. It's a crime scene. And now when everything hit the fan 2 days after my dad died, we have so many questions as to why things went the way it did. But I do have hope that between the investigation from the coroner's office and the criminal investigation from the police, we will get reporting and answers that will develop a completely new framework going forward.
But as I'm waiting here for Prime Minister Trudeau, just tell me one thing about Stanley. What kind of fellow was he? I know he was from Winnipeg, just like me. What else should I know about him?
Brilliant mind, masters in physics, could talk on any conversation, loved to visit, was raised 3 kids after my mom died when I was 17, took on 2 foster kids 3 years later when their parents passed. Every person that's reached out to me just talked about his kindness and how he shaped their lives. My life, my sister's life, my foster siblings, and many others, family, friends, their lives are what they are now because of my dad. And I don't ever want to think that he died as a number or a statistic. He was a human being. He had a busy life. He deserved so much better, as did every other member who has passed in that home and every other home across this country.
Moira, I'm going to go because the Prime Minister is speaking. Again, my condolences about your father, Stanley, and to your whole family. Thanks for speaking with us, Moira. Here is the Prime Minister of Canada.
Today, we're announcing more help for more Canadians.
Oh, that's fine. I didn't notice
This
it.
includes topping up the pay of essential workers. At the same time, we'll also be expanding the Canada Emergency Response Benefit to reach people who are earning some income, as well as for seasonal workers who are facing no jobs, and for those who've run out of EI recently. And a little later, I'll have some news about where we are with testing. Au Parlement, vous m'avez entendu parler des
Parliament, you heard me talk about the contributions of the largest generation, people who grew up and fought in World War II. Now, right across the country, the last members of this generation are now living in seniors' homes and long-term care facilities. The truth is tragic and worrisome. These are the places where we look after our seniors, and yet they are particularly vulnerable to COVID-19. This is something I want to address with the premiers during a discussion tomorrow evening. We must all do better. We must all show leadership to support those seniors who built this country. To begin with, our government will be working with the provinces and territories to increase the pay of our essential workers earning less than $2,500 a month, and the same applies to long-term facility workers.
About the contributions of the greatest generation who grew up during the Depression and fought through the Second World War. Today, across the country, the last members of this generation live in nursing homes and long-term care facilities. The uncomfortable and tragic truth is that the very places that care for our elderly are the most vulnerable to COVID-19. I will be addressing this with premiers tomorrow night. We all need to do better. We all need to take leadership for the seniors who've built this country. Our government will work with the provinces and territories to boost wages for essential workers who are making under $2,500 a month, like those in our long-term care facilities. For many workers looking after the most vulnerable Canadians, including seniors and those with disabilities, we know conditions have gotten more difficult over the past weeks, and you need support right now. Tomorrow, in our weekly meeting, I will discuss with provincial and territorial leaders the importance of getting this wage boost in place as quickly as possible. As we face an unprecedented threat to public health, you are our most important line of defense. We will do whatever we can to help you do your job and support you through this time. En mars, notre
In
gouvernement
March, our government introduced the Canada Emergency Response Benefit. This measure is part of a plan that we put in place to ensure that everyone can receive the necessary help to come through this difficult period. Millions of Canadians have already received the benefit, but we know that many other people were not eligible, and yet they still need help. So today, we will be relaxing the criteria to allow even more Canadians to benefit from it. If you earn $1,000 a month or less, you can now receive the Canada Emergency Response Benefit, because many people do not work as many hours as before, and others must adjust to the reality of contract or gig work. Workers who have run out of EI benefits recently will also be able to receive the benefit. And across the country, many people will not have any seasonal work this year because of the pandemic, and therefore the CERB will also be available to them. This is a difficult context as well for creators and artists right across the country. Cultural venues are closed and work is rare. Minister Guilbeault has heard from artists who are asking that copyright for their work before the crisis happened not make them ineligible for the CERB. And therefore, at these anxious times, artists continue to help us reflect on life and dream. They bring sunshine into our daily lives, and we are very grateful for that.
Today, I can announce that we are expanding the Canada Emergency Response Benefit to include people making up to $1,000 a month, seasonal workers, and people whose EI has recently run out. Maybe you're a volunteer firefighter or a contractor who can pick up some shifts, or you have a part-time job in a grocery store. Even if you're still working, or if you want to start working again, you probably need help in making ends meet. So if you earn $1,000 or less a month, you'll now be able to apply for the CERB. If you were expecting a seasonal job that isn't coming because of COVID-19, you'll now be able to apply. And if you've run out of EI since January 1st, you can now apply for the CERB as well. And for others who still need help, including post-secondary students and businesses worried about commercial rent, we'll have more to say to you very soon. No matter who you are or where you live, we're in your corner. After accepting
an initial request for help from the CAF from Nunavut, Quebec sent us a request for the North Shore, and I can confirm that the Canadian Rangers will be there to lend a hand.
Accepted the first demand for help from the Canadian Armed Forces for Nunavik, the Government of Quebec has sent us a second request for Basse-Côte-Nord. I can confirm that the Canadian Rangers will be there to provide support. I want to thank our women and men in uniform and the families who serve alongside them for all that they do. Whenever we need you most, you're always there for us. Par moment,
From time to time, we may feel overwhelmed by events. We're in a situation that may seem unreal, and it's not always easy to deal with everything happening around us. This week, the government is launching a new portal that will bring together mental health resources and will make them available to Canadians. You can go to Canada.ca or use the application Canada COVID-19 to talk to someone. There is no reason to feel embarrassed about that. The important thing is to get the help you need.
If you're feeling overwhelmed, know that you aren't alone, and there are people who can help. We have launched a mental health portal at Canada.ca and through the Canada COVID-19 app, where you can go to find support. So if you need to, please reach out. We'll be there for each other. Finally, we have more news today to share on testing. Lumen Ultra from New Brunswick, with whom we signed a contract, is now ramping up production to supply enough COVID-19 test chemicals to meet the weekly demand in all provinces. And in the last few days, we received a new batch of swabs to make sure every province has the supplies they need to keep testing. Whether it's reagents or test kits, we are ensuring that Canada has the tools to fight this virus. Tomorrow, I'll also be speaking with the other G7 leaders about continuing to coordinate a strong and effective global response to this pandemic.
The business Lumen Ultra in New Brunswick is now ramping up its production capacity in order to provide enough chemicals for COVID-19 test kits and tests that need to be conducted in the provinces and territories. Up until now, we have also received a new batch of swabs. I know that everyone wants to know when life will go back to normal, but the reality is that we cannot give you a specific date. But this is what we know. For this to be over, people have to stay home. We have to limit our movements as much as possible and keep a distance of 2 meters from others. And if everyone does his or her part, we will come through this together. Thank you.
Thank you, Prime Minister. We'll now go to the phone for questions. There will be one question and one follow-up. Operator.
Thank you. Merci. La première question, Michel Lamarche, TVA Nouvelle, à vous.
Good morning, Mr. Trudeau. I'd like to hear you comment on the discussions with Quebec with respect to the intervention of the Canadian Armed Forces in long-term care facilities. We're told that people from the medical division may not be enough, so are the troops or is the CAF ready to intervene? Those discussions continue with Quebec and the other provinces to see how we can help even more. We have developed a portal where people of experience, with medical experience or special experience, can provide their help, and we shared that portal with all the provinces. We continue to work directly with Quebec on their requests for more resources, and we will continue to work with Quebec on that. A follow-up? Yes, you're not really answering the question. I understand that you're working on this, but are there discussions? Quebec said yesterday, we need people on the ground now. Why is nothing being done right now? And other than medical personnel, can you send in military personnel to serve meals, pick up garbage? What exactly can you do immediately? Well, immediately, right now, we are working with Quebec as to how we can help. We know that there are needs out there in Quebec and right across the country, and that's why we're working with the provinces to provide them wherever possible the resources that they require. We are there to be their partners. We are there to pursue these discussions and bring in help as quickly as possible if it's necessary.
Merci. Prochaine question. Operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Good morning, Mr. Trudeau. I'd like you to comment on the decision by the United States to freeze its funding for the World Health Organization. My priority and the priority of our government right now is to do everything we can to protect Canadians and ensure the health and safety of people right across the country. And that means working with experts here in Canada and around the world, and we will continue to do that important work for Canadians.
One of the things that is so important for Canada to do is to continue to work with local experts and international experts to do everything we can to fight this virus and keep Canadians safe and protected. That's what we will continue to do.
Je veux bien, mais
That's
craignez-vous
fine.
que ça ait des conséquences?
But are you not concerned that this will have consequences for the global fight against COVID-19? Well, tomorrow I will have an opportunity to speak to other G7 leaders to talk about how we can properly coordinate our efforts and continue to work together to fight COVID-19 and, of course, coordinate our approach based on science and evidence and working with experts around the world.
Merci. Prochaine question.
Thank you. Merci. The next question, Justin Ling, freelance. Please go ahead.
Hi there, Prime Minister. Obviously, I've been asking you for about a month now about the state of Canada's prisons. You've promised repeatedly that new measures would be coming, that the Minister of Public Safety would be announcing new cooperation with the parole board. We still haven't seen any of that. So is this just not a priority? Is nothing coming? Is there even going to be a decision about those inmates who are being released on day passes, like other provinces have done, to release them temporarily? Is there any announcement coming?
We have made significant efforts and taken significant steps to ensure that our incarcerated population is kept as safe as possible from COVID-19. There are a number of measures that we've taken. We continue to look at more measures. We're coordinating with the provinces on these efforts as well. We know that this is an area where we've seen challenges in terms of outbreaks, but we also are continuing to step up our efforts every day to ensure that all Canadians are protected.
So you say you're stepping up your efforts. The directive from the Commissioner last week said that corrections officers should wear face masks. The Corrections Canada has previously said they're providing soap and hand sanitizer. By all accounts, those things aren't happening. So if the work you're doing isn't happening, do you need to change tack? And finally, have you totally abandoned the idea of releasing federal inmates?
There have been a number of discussions at the highest levels about various processes that need to be put in place. There have been a reduction in transfers, in issues that have put potentially people who work there and people who are incarcerated there more at risk. We have taken a number of measures. We will continue to look at taking more measures, and we will ensure that the measures in place are properly followed. Okay. We
recognize that it's important to ensure that we protect people who work in our federal institutions as well as inmates. And that's why we have taken specific measures, and we are continuing to monitor the situation to see that they're followed. And of course, we will seek other ways to ensure the protection of those people.
Merci. One more question on the phone, operator.
Thank you. Merci. Next question, Jim Bronskill, Canadian Press. Please go ahead.
Good morning, Prime Minister. Social distancing advice differs from jurisdiction to jurisdiction, from Vancouver closing Stanley Park to cars, so more people can walk around it, to Ottawa's local experts telling people to basically not chat on their driveway with neighbors. In light of this, how do you sustain public confidence in social distancing measures?
I think we've been very, very clear that the best way to prevent further spread of COVID-19 is to stay home as much as possible. If you have to go out infrequently and keep 2 meters distance from each other and wash your hands aggressively and often. These are the things that we're asking all Canadians to do. across the country, we recognize that different communities are in different situations, that there are different local health experts giving advice that is suitable to that particular context. We make sure that everyone is getting the message that we all have to do our part to fight COVID-19, and that means engaging in social distancing, but it is perfectly normal that there be slight variances in approaches in a pandemic that is manifesting itself in very different ways in different parts of the country. Okay. Nous soulignons à quel point c'est important de
have been saying how important it is to take actions in order to protect yourself and to ensure that COVID-19 will not spread further. That means staying home as much as possible, not going out unless it's absolutely necessary, and also keeping a 2-meter distance from others if you must, and regularly and aggressively washing your hands. Now, of course, in various regions of the country, there are different situations as regards the pandemic, so there are variations in experts' recommendations, but the major recommendation remains. We must do everything we can to keep practicing physical distancing and prevent the further spread of COVID-19.
On the World Health Organization, how much total financial support is Canada now providing to the organization? And has the U.S. president ever put any pressure on Canada to either boost or, of late, reduce its support for the organization?
Canada's support for the World Health Organization is in the tens of millions of dollars. I think we've increased it recently, but I can make sure that someone has the exact numbers for you or for the media. No, the President hasn't made any direct asks or indirect asks of Canada around that.
Français.
Okay. Je crois que on appuie
I believe our support for the WHO is in the order of $10 million per year. I know we recently increased our contribution as a result of the pandemic, but I will be sure that you have a specific answer to that in the coming hours. And no, the President has not asked Canada to do anything with respect to funding for the WHO.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly said how much Canada has relied on WHO for information about what's happening around the world. Are you satisfied the organization sufficiently interrogated the information coming out of China in the early days of the pandemic? We know now a lot of the information was either false or misleading, especially about human-to-human transmission. Do you think they did a good job on how they handled that information and shared it with other countries?
I think what we need to remember is the path through this pandemic is for us to base ourselves on science, on the recommendations of experts, on the data and the knowledge that we've gathered from past pandemics and past health issues to apply to these situations. And that's why we will always continue to work with experts, both domestically and internationally, to take the best advice possible in keeping Canadians safe. Of course, in the coming months and years, there will be many reflections on various institutions and systems, both domestically and internationally, on how we can improve our response, how we can learn from things we could have done better in this process. These are things that will come in the coming times. Right now, our focus needs to be on doing the best we can right now to protect Canadians.
We're hearing about potential shortages of medication used for pain-killing and sedation before patients are intubated and put on ventilators. What's happening at the federal level to ensure that there's a continued supply of those medications?
Public Health Canada and Procurement Canada are working together to ensure the steady supply of essential medications to Canada, both related to COVID-19 and not. We recognize that this is a global health crisis, so there are challenges, but Canada has a very strong pharmaceutical industry. We have very strong relationships around the world on getting medication and necessary supplies, and we will continue to do everything we can to ensure that Canadians get what they need. Nous avons nos équipes et nos ministères en train de
Our
travailler
teams
avec
and
les
our
provinces,
departments
avec
are
nos
working with the
partenaires à travers le
provinces
monde
and our
pour
partners
s'assurer,
around the world
de la disponibilité
to ensure
des
that there will
médicaments
be
et
the proper availability of medications
des denrées essentielles.
and essential
Nous allons
goods.
toujours, faire ce qu'on a besoin de
And we
faire
will always do
pour
whatever
assurer
we
que les
need to
Canadiens
do to
aient,
ensure
les
that
produits
Canadians
nécessaires.
have
On
the
reconnaît qu'on est dans une crise de
products
santé
and
mondiale,
medications they
mais
need.
le Canada,
We know that we're in a global
devrait
crisis
toujours
at this
avoir,
time, but
l'équipement
Canada will
nécessaire pour
always
aider les
have
Canadiens.
the equipment it needs for Canadians.
It's Tom Perry with CBC News. On the WHO, you were just asked this, but the Conservatives and others have raised concerns that the WHO was too willing to take the word of the Chinese regime early on in the pandemic. Do you share those concerns?
I think there's obviously reflections that we have to have going forward, and we have to make sure that we are doing everything we can to keep Canadians safe. And that is our focus right now. What can we do now? What do we need to do in the coming weeks? How do we lean on experts in international institutions and in partner countries around the world who are making recommendations alongside our domestic experts on what we need to do now? There will be plenty of time as we move forward to reflect on challenges that were faced in the past. We need to learn and move forward as quickly as we can.
And you said yesterday that you're talking to the provinces and territories about eventually reopening the economy. Can you say what work specifically you're doing with the provinces and territories to do this? And you also said that they're at different points along the spectrum of the pandemic. So do you see when things do start returning to normal, is that going to be on a provincial level, a local level, a national level? How's it going to work?
Well, we recognize that this pandemic is going through very different phases at different points, different places across the country. One size fits all will not work for a country as diverse as Canada, but the overarching principles are extremely important. We know, regardless of where you are in the country, we need to get through this first wave before we can start releasing some of the rules around social distancing and staying at home. How that release works will vary from region to region, from industry to industry, and coordination at the federal level on how we do that is going to be very important. But with spring coming, people are looking outside, wanting to get out, wanting this to be over. I understand that. It will be weeks more before we can seriously consider loosening the restrictions. It would be terrible if we were to release restrictions too early and find out that we're suddenly back in another big wave of COVID-19 and everything we've gone through up to now would have been for nothing, because we'll find ourselves once again in the same situation. If we hold on through this period now, as long as we have to, once we are able to release things, we will be able to better control how things move forward. But as impatient as people are getting all across the country, we need to continue to hold on if what we're doing now as sacrifices are going to be worth it. Okay.
I recognize that people want to know when this is going to be over and when we can relax the rules on social distancing and kickstart our economy again. The reality is that if we start to relax those restrictions too quickly, we may very soon find ourselves in the same situation as now, or even worse, with a new wave coming almost immediately. And in that case, everything we will have done and what we're doing now will have been for naught. Now people are making sacrifices right now. They're going through very difficult times, and we're going to have to continue to do that for a number of weeks yet in order to be ready to properly manage and be vigilant as we gradually come out of this. Yes, we'll have to coordinate that with the provinces, but we will especially have to remain in this phase for a while yet to ensure that when we can relax the restrictions, we will not end up in the same situation a few months later.
Prime Minister Janet Silver, Global News. I know you've just spoken about a coordinated effort and some more patience needed in terms of reopening the economy. But just to follow up on that, I'm wondering whether you envision when that happens that workers will be tested before they return to work?
Obviously, when we are able to loosen the controls on social distancing and start to reopen our economy, massive, rapid testing on a very wide-scale basis will be an essential part of the vigilance we have to have. There will also be a need for very aggressive contact tracing whenever there is a case that appears. We are going to have to be extremely quick about responding to any future outbreaks in future waves. But in order to get to that point, we need to continue doing what we are doing now for many more weeks. We cannot be in a rush to get things going again, because if we move too quickly to loosen all these controls, everything we're doing now might have been for nothing. We'll find ourselves in another peak just as bad as this one or worse, and it will be extremely damaging both to how Canadians feel, but also to our economy. That's why we are going to be extremely careful about any steps towards reopening the economy. It seems like over the past days, people are talking about, oh, when we reopen this, we'll do this, we'll reopen that. It's not happening yet. If we reopen too soon, everything we're doing now might be for nothing. We are making sacrifices. We're there for each other. We need to hold on still. And then, once we're ready, once we feel we're through, once the experts are telling us that we can talk about reopening the economy a little bit, we will take very careful steps and do that. Okay. Je reconnais.
I realize that for a number of days, people have been talking about opening up the economy again and getting back to work and being able to go outside. And obviously, with spring here, people are anxious to do that. But I have to tell you, we are not at that stage yet. We're far from that stage. If we reopen things too quickly, we could very easily find ourselves in an even worse situation than right now. And all we will have done, and everything we've been doing for the last few weeks, will have been for nothing, and we'll have to start all over again. We do not want that to happen. So please be patient. Please continue to show the kind of discipline we've seen in you Canadians. Let's continue to protect our healthcare workers and do everything we can to protect our seniors. And we will get through this, but we have to stay the course.
Prime Minister, as we see the horrific stories unfold each day across the country with regards to long-term care facilities, people getting sick, people being abandoned, many dying, if your mom was in one of these facilities, what would you do?
I can't imagine what so many Canadians are going through right now with loved ones who are suffering, people they can't even visit right now, seniors worried about falling ill and not being able to see their kids and grandkids again. These are the things that we need to focus on as a country. That is what I will be speaking with premiers about tomorrow night, how the federal government can support the premiers in their responsibility in their jurisdiction over long-term care facilities and senior care, to make sure that we are supporting the heroes who are working in extraordinarily difficult situations for very low pay, to continue that work safely and mostly to keep our elders safe. This is a situation where, as a society, as a country, we need to pull together to be there for our elders who built this country. That's what we're going to focus on in the coming days.
We recognize that it's absolutely essential to be there for our seniors and to be there as well for people who are receiving only very modest salaries in order to help our seniors. We must continue to be there for them, and that's what I will be addressing with the premiers tomorrow, to see how we can support the people who are working with our seniors and elderly, and also ensure that they remain healthy and safe. They are going through very difficult times. They're anxious, they're afraid, and they are uncertain as to whether they're going to be able to see their children or their grandchildren. And as a society, we have to do better for them. Radio-Canada. Now, with respect to the long-term care facilities, the Army could possibly help out. Now, do you want to send in only medical personnel, or are you thinking about sending in other people who are now part of the CAF to help out the personnel there who are totally overwhelmed? We are currently in discussions with Quebec and the other provinces to see how we can provide them with more resources. As I said, I received 2 specific requests from Quebec to send in the CAF to Nunavik and the Lower North Shore, and we will continue to work with the province and respond to any request that is made with respect to anything. We are there to help and work with the provinces as they see fit.
There have been 2 requests so far by Quebec to send in support from the Canadian Armed Forces in both Nunavik, in northern Quebec, and in Basse-Côte-Nord. These are things that we are doing. As any more requests come in, we will look to support Quebec or other provinces who are asking for help from the federal government, regardless of what that help looks like and what they're asking us. We will be there to help out as provinces need help.
Sur la pandémie comme telle, vous dites qu'il faut continuer
to the pandemic, you're saying we have to continue to do what we're doing to stop the pandemic. But right now, we're trying to stop the spread. But until there's collective immunization or a vaccine, and it will take a long time before we get a vaccine, are there scenarios your government is looking at in terms of collective immunization? And this would be for certain sectors to be able to start up and perhaps protect certain groups. Well, our priority is to avoid seeing our healthcare system overwhelmed and a mortality rate of 2 or 3 going from 2 or 3% to 10% as we saw in other countries. That is absolutely what we want to avoid. So yes, we are slowing the spread of the virus, and we're also developing methods and technical capacities in terms of testing and the ability to do quick contact tracing so that we know who may have been infected at one point or another. And we are developing these tools in order to be extremely vigilant once we've come through this first wave of COVID-19, so that we can perhaps relax some of the restrictions on citizens and on the economy. But at the same time, we know that as long as there is no vaccine, we will have to continue to be extremely vigilant and to respond very quickly if there's a resurgence of COVID-19. And it's all of those reflections that are ongoing at this point. But as I've said, we will need to remain in this phase of severe restrictions for a while in order to have that ability and to be able to look at the next steps.
We know that until there is a vaccine for COVID-19, we are going to have to remain extremely vigilant as a world, as a country, to resurgences, even once this first wave is through. Once we see this first wave pass through Canada without having overwhelmed our healthcare system and our healthcare workers, as we certainly hope, we will be able to look very carefully at how, with extraordinary vigilance and very rapid response times to any future resurgences of the virus, we can carefully re-engage in certain sectors of our economy in loosening up the restrictions. But we are not there yet. We have to be through this first wave sufficiently to be able to know that we have the capacity to stamp out and restrict any future outbreaks as they come along. That means technology, that means better testing capacities, that means continued vigilance, not just by governments, but by all Canadians to preventing it. We're still a number of weeks away from that, but we are reflecting on what that looks like and what sort of technology and medical solutions will be necessary. We will get through this together, but for now, we need to stay strong in our social distancing measures and by staying at home. Merci beaucoup tout le monde.
Canada giving his daily briefing to Canadians on how his government is fighting COVID-19. Lots of news out of what he had to say there today. Let me point to two little pieces to keep our eye on for tomorrow. Both a call with G7 leaders tomorrow where the issue of the WHO and funding will come up, but also a call scheduled with premiers who he's been speaking to on a weekly basis where the issue of long-term care centres is supposed to be addressed too. Let me go to my colleagues, Vashi Kapellas and David Cochran. Maybe let's start with the CERB, Vashi, because those are some significant changes that broaden things for a lot of Canadians who had felt kind of hopeless, frankly, and left out. Lots more will be included now.
Yeah, this is definitely a very significant announcement and one the Prime Minister had signaled was coming. The opposition, both opposition parties, but primarily the NDP have really pushed this issue. So the idea of people who were not yet covered by the CERB, and specifically what the Prime Minister announced today was those, for example, who earn less than $1,000 a month, they will now be able to apply. So that's really a lot of people, for example, who have seen their income cut. It's gone for the most part, but it's not completely wiped out, which was a prerequisite prior to today for accessing the CERB. In addition, seasonal workers, we had heard a lot from those who don't anticipate they'll be able to access that work, can access the CERB. Also, if your EI benefits have dissipated, if you no longer have them, you can access it as well. And just on the final point that you made there, Rosie, about the call with the premiers, long-term care homes, we have seen some provinces move to top up the pay of people who work in those homes. The Prime Minister had previously signaled he was looking at a more national approach to that. He did indicate today that that was coming and that there would be some sort of discussion with the premiers around that. I don't know specifically how that would work or the degree to which the top-up would happen. I think he had some specifics around how much people were making. I think it was something like less than $2,500 a month.
Yeah,
I think so. So we'll look to see exactly what that means, but you could see that the focus that we've seen from provinces, it is provincial jurisdiction, on the issue, on what we're seeing of the spread of COVID-19 within these long-term care homes is now going to be a primary point of discussion between the premiers and the Prime Minister. And I'm very curious to see what more the federal government can do. They've put out some guidelines, but they are just that, guidelines, because of provincial jurisdiction. Are there any moves behind the scenes to sort of up the federal oversight of what's happening in long-term care homes? Because we know from your discussion, for example, with your last guest, that it is a pretty serious situation in them right across the country.
Yeah, and it is very unfortunate that it took this pandemic to bring attention to something that clearly has been a problem for some time. David Common reporting today that 9 out of 626 Ontario nursing homes received inspections last year. So almost none of them, frankly. David Cochran, maybe get you to go on the WHO there. The Prime Minister was asked about Trump suspending his funding to the WHO.
Yeah, Canada is not going to change its approach based on what the United States has done, and the United States has put no pressure on Canada to change its approach. But I sort of just want to pivot back to the CERB and the top-up for essential workers, $2,500 a month. That's $30,000 a year for an essential worker. Just think about the economics of that and what that actually tells us about what's happening in long-term care homes. This was discussed last week with the premiers, where the Prime Minister said last Thursday that this is something that he wanted to look at and needed to find a way. I think the urgency of what has unfolded since last Thursday and today has certainly heightened the need to get cash into the system to make sure that more workers aren't compelled to leave and they can entice other people to go in. On the CERB and the expansion of that, they're sort of making it as universal as possible without making it completely universal. But the the urgency we're seeing on getting that done, Rosie, comes from the numbers we saw from the Bank of Canada today. I mean, they kept their rate at 0.25%, but they said economic activity went down by 1 to 3% in the first quarter of this year. It's going to go down by 15 to 30% in the next quarter. Between April and June, they're expecting a drop of up to 30% in economic activity. That is why expanding CERB criteria is so important. Seasonal workers, I know in Atlantic Canada, the fishery, they're worried about being able to physically distance on boats and in plants. They may not open because of this, so this is why this is so needed.
Sure, and StatsCan today saying that the GDP dropped by at least 9% just in March. Okay, thank you both very much. I'm going to have to leave you and come back for our federal press conference at the top of the hour. The Prime Minister broadly expanding that emergency relief benefit. So if you had questions, whether you qualified, check out online because you might now. I'm Rosemary Barton. You can watch our ongoing coverage on CBC News Network and CBC.ca. See you tomorrow. Hello again, I'm Rosemary Barton here in Ottawa. Welcome again, wherever you might be watching us on CBC News Network and around the world on the CBC News app and CBCNews.ca. The Prime Minister says Canada does need to do better to protect seniors in long-term care homes during the pandemic. He just announced that he'll be speaking with Canada's premiers about how to improve conditions for residents and salaries for workers on the front lines during COVID-19. Justin Trudeau also announced an expansion of the Canada Emergency Response benefit. It will now include those who are working fewer hours, $1,000 a month, as well as some essential worker help to come. He also said students and businesses who need help with commercial rent should stay tuned. There'll be more information for them in the coming days too. All right, I want to turn our attention, if I can, to a more uplifting story as we wait for federal officials, cabinet ministers and public health officials to come up and give us a briefing, probably more details on the CERB and ongoing questions about the WHO, and I'll come to my colleagues in just a moment for that too. But first, let me bring in Joe Totungal. He's the owner and chef at two restaurants in Ottawa, Thali and Coconut Lagoon, and he's in his kitchen making me hungry, and he's been using his expertise to make meals for people in this city for shelters, I believe, but maybe also essential workers. Joe, good to see you.
Hi, Rosemary. How are you?
I'm good. Thanks for making the time. So tell me what you're doing to help out in the midst of all this.
Yeah. During this pandemic time, what we did is just giving some hot meals. Around 600 meals we did last week, pretty much every day, and now it's bumped up to 900 hot meals every day from this kitchen because we are closed. This restaurant Thali is closed at the moment, and the food is going to different shelters and residents where the people not even have a hot meal a day. So that is what we are trying to do. Every day the menu changes. I get a lot of help from different chefs around the city, and they come and cook together as a family here.
That's incredible. That's incredible. So how are your restaurant shut down? I know you have takeout and delivery, but how are you affording this? How can you do this at a time when you're not making any money?
Yeah, we getting donation, and the chefs are working all for volunteer basis. And we make the deals with the different producers, like Cisco is a good help for us. They're giving a lot of supplies which they have stocked up in their inventory. So we're bringing it in and cooking together. The good meal, but at the real less expensive, but a good hot meal. Who else don't want that good meal like that, you know? So
you're bringing it to homeless shelters, residences. Who's getting this?
Different residences. Some of the people who sheltered in different places, you know, families with kids which don't have a cooking, even don't have a kitchen. So they're not afford to get a hot meal every day. So that is what we are providing at the moment.
And Joe, I know lots of people in Ottawa know you and know your restaurants and know what you're like, but explain to Canadians why you're doing this, why you felt the need to do it.
Because I am blessed to be in Canada and running a 16 years of restaurant business. You know, I am blessed. I serve the most prestigious people. I think this is the time we should help the needy people. And we are here, and only thing I know is how to cook good food. So why not give a meal when somebody is hungry? That is a gift you can give. That is, I think, as a karma to do. So that is what I'm trying to do without any not much expense, you know. That is what I'm doing.
And do you think your restaurants will be open when this is all over, Joe? Do you think you'll be able to reopen?
Yeah, we will. We are in good standing because we were here 16 years and the community supported us. And this is a time to go back. And I'm thankful the Canada government is doing a lot of good things even for business, the employees and all that. So once this is over, we will come back and serve the same thing. No problem.
Okay, Joe, I'm going to leave it there. Joe Tutengal, thank you. I appreciate speaking with you, and happy lunch.
Thank you.
Stay healthy. Good to see you. All right, wanted to make sure it is good to take a breather once in a while and reach out and show someone who's doing something extraordinary in these difficult times. That's certainly the case for Joe. All right, as we stand by and wait for our briefing from federal cabinet ministers and public health officials, do want to go back to this issue of World Health, the World Health Organization and funding after Donald Trump yesterday announced that he would be suspending his funding as the largest donor to the WHO. Yeah. Concerns around how China and the WHO were interacting. My producer did get the number that Justin Trudeau did not have, which is how much Canada contributes to the WHO. It is about $71 million Canadian annually. It is the 17th biggest donor, just after China, actually, to the WHO. And I want to bring in Vashi Kapelas on this point because while he was asked very directly about this, the answer was diplomatic, to say the least, Vashi.
Yeah, I think this is a really interesting subject. It obviously follows, as you mentioned, Rosie, on what the President of the United States announced yesterday, the withholding of funds, of American funds for the WHO. He also, the Prime Minister mentioned, he didn't have the exact figure that you just were able to provide, but he said that he thought they had recently increased their contribution due to the pandemic. So it'll be interesting to see if it's in addition to what's there. He said there had been no pressure, either indirect or directly, from the United States, from President Trump, to follow suit, to withdraw Canadian funding from the WHO. But when he was asked very specifically, and he has received this question before, I think about 10 days ago or about a week ago, on whether he trusts the data, whether the government here should be trusting the data and the information coming out of China, he didn't specifically address the question. He talked about the importance of science and the importance of working together with other leaders. He mentioned the G7 call that will take place tomorrow. But he didn't say one way or the other if the data coming out of China is reliable. He did echo what he said in the past, in that those questions could be asked and should be asked, and that they probably will be asked. But he didn't provide sort of a Canadian position on the validity of the data coming out of China and whether or not he has specific concerns about what appears to be a heavy reliance from the WHO, or at least that's how it's characterized by some, including President Trump, on that data coming out of China. The other thing I would bring up, and this looks ahead to the press conference that's coming up, I believe the Health Minister, Patty Hajdu, will be there. I also remember on the first day that the Prime Minister got questions on this, she received them at this briefing as well. And I remember her comments really stuck out for me because I think specifically she said there's no indication that the data that came out of China in terms of their infection rate and their death rate was falsified in any way. And when she received a follow-up question, she essentially accused the reporter of feeding into conspiracy theories. So I'm curious to see if her position has changed in light of some of the information that has come out in the past 10 days or since those comments were originally made, and in light also of the sort of pivot in conversation around the world. I'd be remiss if I didn't point out that it's not like people are supportive everywhere of the decision to withhold WHO funding. It does perform a very important function, especially in developing countries. In fact, there's been a lot of criticism of the decision to withhold funding, but at the same time, congruently, that doesn't mean that people aren't also asking questions about China, about how they've handled this, about how transparent or the lack of transparency that exhibited there, and the WHO's reliance on that information.
Yeah, I mean, part of the problem for the WHO is it is only as good as the data that it is getting from countries that have outbreaks. And so it is making decisions based on that information, which we now know, as David talked about earlier, according to the Associated Press, was not accurate, that there were, at least if you believe these reports, there was an attempt to withhold information for a period of 6 days inside China. No one, I think, would believe that China is the most transparent or forthcoming forthcoming country when it comes to any information of any kind. So I guess the question people should have and would have right now is how reliant or how should the WHO operate, knowing that fact, knowing that China does not have the same kind of disclosure and transparency that other countries have. And I'm glad you brought up the Patty Hajdu situation, that question, Vashi, because she was certainly heavily criticized for suggesting that China had been truthful and honest with all of its reporting. But David, bring you in here. It sort of goes to what you were saying earlier. This is a very delicate dance, and one that Canada finds itself in with China time after time, whether it be with the Canadians who are being held in prison without charges right now. All these things we have to manage in terms of how much we need China versus what their impact is in other situations around the world. Yeah,
it's a very delicate geopolitical dance at a time of global crisis, right? I mean, they sort of resisted a lot of the strong language even when dealing with Michael Spavor and Michael Kovrich's cases and the arbitrary detentions, apparently in retaliation or seemingly almost obviously in retaliation for the detention of Meng Wanzhou in the Huawei extradition case to the United States. And it's key to point out too, Rosie, that it's not just people like Jason Kenney or Donald Trump and people on the right side of the political spectrum, the conservative side of the spectrum, that are criticizing China. I mean, Irwin Cotler, former Liberal cabinet minister, wrote a very blistering op-ed in an Israeli newspaper and reprinted in the Globe and Mail this week, basically talking about how China's secrecy and the rule of President Xi to clamp down on the release of information has allowed this pandemic to accelerate in a way that it would not have or might not have, because nothing is certain when you're dealing with pandemics, had full disclosure and transparency happened earlier. So China undoubtedly is a massive problem in the beginning of this, because this is where it started, and there's pretty clear signs now and ample reporting that there was a cover-up of some sort. And the challenge, though, remains that in the here and now of today, in dealing with this, in a country that has not yet hit its peak, in a country that has a crisis in its long-term care homes, Canada does not yet have a consistent and robust enough domestic supply of personal protective equipment. It needs China. It needs factories, it needs equipment, and it needs those shipments. So while Trump can do what Trump does because it is the United States and it plays by an entirely different set of rules than a middle power like Canada can ever hope to play by, there is a delicacy and a diplomacy required here. Because the planes that are going into China need permission to land there, and the factories, they need to be able to negotiate and buy with them, or that PPE supply that the federal government is buying to backstop the provincial procurement efforts, that can dry up pretty quickly if the Chinese government decides it doesn't like what we say and decides to play hardball in retaliation. And I see it on the side of my screen here, but let me also say it for people, because the head of the WHO did have a virtual press conference earlier today, said he regretted the U.S. president's decision to pull funding for the organization, called on the world for unity to fight the pandemic. He says the WHO is assessing the impact and will try to fill any gaps with partners. Again, it's a suspension of money for now, but it could be a permanent decision if the U.S. administration decides that this is not where they want their money to go, or there are indications the WHO isn't doing what they want it to do. Again, the Prime Minister saying this will come up at a G7 call tomorrow. Of course, Donald Trump will also be on that call. Okay, as we stand by and wait for our federal briefing at this hour, do want to bring in one more guest if I can squeeze him in. The International Relief Organization, Médecins Sans Frontières, Doctors Without Borders, is taking action that it has never taken before. It is launching an operation inside Canada, inside this country, and the group's executive director, Joe Belliveau, joins us now from Toronto. Good to see you, Mr. Belliveau.
Yes, hello, Rosemary.
So this is unprecedented. I'm not mistaken. What made the decision? How did you make the decision that Canada needed help inside our own borders?
Like you said, unprecedented decision. Normally, our group, I'm sure your viewers know us as an organization that goes anywhere in the world to help the most vulnerable, the people most in need of medical assistance wherever they are. Now, normally that takes us to places like Yemen or the camps in Bangladesh or South Sudan. So it's very rare that we would consider to intervene and to assist in a context where there's a highly functioning health system, where the standard of living is high, where it's peaceful. So it's exceptional. And the reason why we're breaking with tradition in this moment in time is it's a double reason. The first is that even in a context like Canada, where the system is developed, healthcare is widely available, there are still communities that are particularly at risk. And people experiencing homelessness right now in Toronto and other places in Canada are one such group. And the other reason is because now, with decades of experience of outbreak response, Médecins Sans Frontières has accumulated a wealth of expertise and knowledge. So our role, uncharacteristically in this case, normally we're out there with boots on the ground, hands-on medical treatment. Our role here is to share that expertise with other frontline actors here in Canada.
And how did it come about? Was it an offer, or was it the City of Toronto saying we need help with some of our homeless population or vulnerable population?
Well, it started with us scanning around Canada, looking for the people who would be most at risk, looking for the people who might slip through the cracks, might be particularly at risk. And that pretty quickly got us into a conversation about people experiencing homelessness. And then we established a dialogue with inner city health associates. So that's who we're collaborating most closely with on this project, together with the health authorities here in Ontario.
And what will you be doing specifically? There's a 400-bed facility, I believe, and people will be housed there and made sure that they are staying healthy and doing the right things. Is that the idea?
Basically, so it's a recovery site. It's for people who don't have homes, who test positive. And right now is a really critical moment for this. Just in the last days, there's been a real uptick in the number of positive cases amongst Toronto's 8,000 to 10,000 people without homes. So it's a critical moment to get a facility set up. As you said, we're planning for about 400 beds now, to get that facility set up so that they can be cared for. Unless they're in an acute phase, if they're in an acute phase, they can still access the hospital system. Sure. But we want to make sure that they have a place to go to get treatment, that it's safe, where they can practice physical distancing, and they get proper care.
Well, as you say, unprecedented times, and you doing something unprecedented inside this country. It's a really good idea, though, Mr. Beliveau. Thank you for speaking with us, and good luck with it, and stay healthy. Thank you very much.
Sure thing. Thanks, Rosemary. Bye.
Okay. Bye-bye. All right, let us go now to the Deputy Prime Minister giving us a daily briefing along with public health officials. More information, certainly, about the emergency relief benefit, which has been expanded as of today. Let's listen in live.
Dr. Tam, please.
Hello, everyone. Bonjour à toutes et à tous. I'll start, as usual, with our update on the number of COVID-19 cases in Canada. There are now 27,557 cases, including 954 deaths. These numbers change again throughout the day. For the lab testing, we've completed tests for over 462,000 people, with about 6% confirmed positive, as Canada continues to improve our testing to better track where the disease is spreading. As Canadians continue to practice physical distancing, we are closely monitoring for signs that our efforts are having an impact on the epidemic curve. It's taken just over 3 months for the first cluster of COVID-19 cases in China to spread globally and establish the pandemic. It is hard to take in how our lives have changed in such fundamental ways over this short period. At this point, we still don't have all the answers, but there is some cause for cautious optimism coming from our epidemiological data. Because COVID-19 is very contagious, even a few cases can quickly multiply, resulting in a steeply rising epidemic curve. This type of increase is referred to as exponential growth, with case numbers doubling every few days. In late March, when the growth rate was the fastest, we saw case numbers doubling every 3 days. But in recent days, we've observed a doubling time of over 10 days. This means the epidemic is slowing down. Though we all wish this could be a sprint to the finish, it is not. This will be a marathon, and there are no rewards for quitting early. To use another analogy, coming down from this epidemic curve will be like making our way down a mountain in the darkness. We mustn't rush or let go of our safety measures, or the fall will be hard and unforgiving. We need to remind ourselves that this is an emerging disease and that we don't know everything, so the terrain will be uncertain. That means we need to go slowly and be sure of our footing before taking each new step on the way down. Along the way, we'll need to closely monitor cases and growth trends to ensure we've got the right public health measures in place to detect and quickly respond to any new cases or clusters. We'll also need to maintain physical distancing during this time. Any break in our resolve could spark a new outbreak and delay our progress. So let's maintain our collective resolve and crush this curve. Thank you.
Thank you very much, Dr. Tam. Maintenant, je donne la parole à Dr. New. Dr. New, s'il vous plaît.
And now, Dr. New. Go ahead, Dr. New. Thank you. Hello, everyone. I'll begin with our usual update on the number of COVID-19 cases in Canada. There are now 27,557 cases of COVID-19 in Canada, including 954 deaths. These numbers change throughout the day. As for lab testing, we've completed tests for over 462,000 people, about 6% of whom have been confirmed positive. Canada continues to improve testing to better track where the disease is spreading. As Canadians continue to practice physical distancing, we are closely monitoring for signs that our efforts are having an impact on the epidemic curve. In just over 3 months, the first cluster of COVID-19 cases in China spread globally and established the pandemic. It is difficult to take in how our lives have changed in such fundamental ways in such a short time. At this point, we don't yet have all the answers, but there is some cause for cautious optimism coming from our epidemiological data. Because COVID-19 is very contagious, even a few cases can quickly multiply, resulting in a steeply rising epidemic curve. This type of increase is referred to as exponential growth. This means that case numbers can double every 2 or 3 days. In late March, when the growth rate was the fastest, we saw case numbers doubling every 3 days. In recent days, however, we've observed a doubling time of about 9 or 10 days. In other words, this means that the epidemic is slowing down. Though we all wish this could be a sprint to the finish line, it is not. This will be a marathon. There are no rewards for quitting early. I'd like to use another analogy. Coming down from this epidemic curve will be like making our way down a mountain in the darkness. We must not rush or let go of our safety measures. If we do, the fall will be hard and unforgiving. We need to remind ourselves that this is an emerging disease. We don't know everything, which means that the terrain will be dangerous and uncertain. That means that we need to go about this slowly and be sure of our footing before taking each new step on the way down and out. Along the way, we will need to closely monitor cases and growth trends to ensure we've got the right public health measures in place to detect and quickly respond to any new cases or clusters, and to react quickly. We'll also need to maintain physical distancing during this time. Any break in our resolve could spark a new outbreak and delay our progress. So, let's maintain our collective resolve. Let's crush this curve. Thank you. Thank you, Dr. New.
Minister Haidu. Patty, please.
Thank you, Deputy Prime Minister.
Hello, everyone. Today, I'd like to talk to you about mental health. It can be difficult to maintain good mental health with all the disruptions we're currently experiencing. It can be difficult to maintain routines. Last week, we talked about modeling. It was a very shocking exercise for some. We heard how the virus could continue to spread in Canada if we don't all continue to follow public health advice.
Living through a pandemic is not easy. Many people are struggling with fear, anxiety, and loneliness. And not being able to use our regular support networks or even practice our regular routines all across Canada means people are struggling. And they need tools to help, including with their mental wellness and health. So as of today, all Canadians have improved access to mental health supports through an online resource called Wellness Together Canada. You can check out this new suite of tools at canada.ca/coronavirus and through the Canada COVID-19 app. This resource has different tools available to meet the variety of Canadian needs. Whether it is anxiety, sadness, or substance use, there is something there for you. The options include an online peer community to talk and share and support others. There are also a number of self-help resources to help with anxiety, stress, or other issues. And there are options such as texting, calling, or connecting by video for a session with a professional to address a specific need. I encourage all Canadians to explore Wellness Together Canada, to use its resources, and to reach out virtually to loved ones. Now, more than ever, we need to stay connected. Thank you.
Okay, thank you very much, Patty. And now we will hear from our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, joining us over video link. Carla, please.
Thank you, Deputy Prime Minister. Hello, bonjour. Comme je l'ai dit depuis le début,
As I've said since the beginning, we have been committed to supporting all workers impacted by COVID-19. That is why we introduced the Canada Emergency Response Benefit, the CERB.
Some workers don't qualify for the CERB, but are still in need of financial assistance, which is why we're expanding the eligibility criteria for this benefit so that it's more inclusive. As announced by the Prime Minister this morning, we are expanding the eligibility of the CERB to allow workers, including self-employed, to earn up to $1,000 per month while still collecting the CERB, to include workers who recently exhausted their EI benefits and are unable to find a job because of COVID-19, and to include seasonal workers who have exhausted their EI benefits and are unable to undertake their usual seasonal work as a result of the COVID-19 outbreak.
These changes reflect the different realities that working Canadians are currently experiencing. We know that people want to remain in the workforce, but have seen a dramatic loss in hours and income due to COVID-19.
The changes announced today will increase the number of workers we can help, including those who still have some income, but not enough now to make ends meet. The CERB will give them the extra support they need. We also know that Canadians, including many seasonal workers who have been collecting EI, may not have jobs to return to and are anxious as their EI benefits have either already run out or will run out soon. These people also need our support and will now be eligible for the CERB. We also want to ensure that our essential workers are supported during this critical time. They are working day in and day out at our hospitals, assisted living care facilities, senior and long-term care homes, and we know the sacrifices you're making to keep us and our loved ones safe. That's why the Prime Minister also announced that he and Minister Marneau are working with the provinces to provide a temporary top-up to salaries for essential workers making less than $2,500 a month.
We know that this is a stressful time for many. We will continue to look for ways to ensure that we help all Canadians during this difficult time. And I'd be happy to take your questions. Thank you.
Thank you very much, Carla. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
And now we will hear from the President of the Treasury Board, Jean-Yves Duclos. Thank you very much, Christia. Hello, everyone. This morning, the Prime Minister made an important announcement. Minister Qualtrough just summarized it for us very well. Today's announcements really puts things into perspective. The economy has been significantly disturbed, which has led the government to take unprecedented economic action and pass unprecedented measures. We have had to strengthen our social safety net. This is the most substantial economic action since the Second World War. And today, we are expanding one part of the government's three-part economic action plan, the Canada Emergency Response Benefit. So now those who are earning $1,000 or less, they have heard today from the Prime Minister that they will now be eligible for the CERB. And those who have lost their income or lost most of their income, for example, artists, the self-employed, freelancers. Today we are helping those who are still making some income but are having difficulty making ends meet. Their income is much decreased. This can include volunteer firefighters who are also working reduced hours. Today, Our announcement is very important. All of these individuals I've just listed, all of these groups will now have access to the CERB, backdated to March 15th. And for those who were worried about juggling taking care of their health and their families, for example, seasonal workers, and also those who have lost their jobs in the past few months and those who have lost their EI, employment insurance benefits, since the 1st of January, they will also be eligible for the Canada Emergency Response Benefit, or CERB. Our thoughts are with essential workers in Quebec and in Canada. Our thoughts are with those who are caring for our seniors. They're working in very difficult circumstances and may be earning less than $2,500 a month. Prime Minister Trudeau made another announcement this morning. He announced that we will be helping these people. They will receive a temporary salary top-up so that they can continue to do the essential work that we need in our society, taking care of seniors and others in need of care. Thank you. Christia? Thank you very much, Jean-Yves. And now we're ready to take questions. Thank you, Deputy Prime Minister. We'll start with 3 questions over the phone line.
Turn to the room, 1 question, 1 follow-up. Operator?
Merci. Thank you. Please press star 1 at this time if you have a question. Appuyez sur l'étoile maintenant si vous avez une question. Notre première question nous vient de Marie Vastel du Devoir. À vous la parole, please go ahead.
The first question is from Marie Vastel, Le Devoir. Question. Hello, Minister Duclos. I have a question about the CERB and about today's announcements. Here's my first question. What will be the total bill for the CERB? How much will it cost the federal government, especially given these new expansions? And how many additional Canadians do you think will be eligible after today's announcement? Answer, Minister Duclos, thank you very much for your questions. Ministers Qualtrough and Morneau will have more information in the upcoming days. Here's what's essential. We are making sure that no one falls through the cracks. We want our social safety net to help as many people as possible. That's why we're expanding the CERB. Quebec has announced measures to help its workers in care homes, and we are following suit. Seasonal workers are also extremely important in Canada, in the East, in Quebec. Seasonal workers at this point in time would normally have seasonal work, but that won't be the case this year. We're also trying to help workers who have lost almost all of their contracts. We're trying to help self-employed workers and those who have seen their income drastically cut. Workers will still be able to have a few contracts, all while being eligible for the CERB. Follow-up question.
You can answer my first question then, and then I'll ask my follow-up at the same time. So my first question was, what is the total bill that you estimate the new CERB will cost, given that it's been expanded to include more workers? How much now do you estimate it will cost? How many more people do you estimate will qualify for the CERB now with those changes that you've announced today? My follow-up then is concerning the hiking of the salaries for essential workers. Can you clarify which essential workers you are looking at? Is it just for long-term residences, or is it other sectors? Is it only health sector? Can you clarify? And will Quebec also get money from that top-up, given that they've already started topping up their own essential workers' salaries?
Well, thank you for those questions. First of all, with respect to the number of workers and the costs, that will, it's a little premature to estimate based on the fact that we don't know the uptake yet of the wage subsidy. We really want employers to hire people back. We want people to switch back from the CERB to the wage subsidy. So right now we're estimating that while the expanded eligibility criteria will indeed allow more people to access the CERB, there will be less people on the CERB once the wage subsidy is fully implemented, because ultimately we want people to go back to their work, to their jobs, and be connected into the labor market as we transition out of this. In terms of the essential workers piece, I'll defer to the Deputy Prime Minister because I know that her colleagues, Minister Monod and herself, are working with provincial territorial governments on this issue.
Thank you, Carla. On the top up for essential workers, this is an effort that we are working on collaboratively with the provinces. The Prime Minister first broached it with the premiers at on the First Minister's call on Thursday. There was an enthusiastic response, and since then I've spoken about it with a few premiers. The Prime Minister has continued to be working on it, and the Finance Minister has been working on it with his colleagues. The Prime Minister intends to make this one of the key issues that we discuss and hopefully come to a resolution on quickly at the First Minister's call with the premiers tomorrow. So the idea is that this would be done collaboratively by the federal government and the provinces. Tu as raison, Marie, que le Québec a déjà fait beaucoup
you are right in stating that Quebec has already taken action on this matter. Quebec has set a great example for the federal government and for other provinces. And Quebec will absolutely not be penalized for being the first province to act.
Next question, please.
Notre prochaine question nous vient de Philippe Vincent Foisy de Radio-Canada.
Next question, Philippe Vincent Foisy, Radio-Canada. Question. Hello. There's something I'm trying to understand. What about the armed forces helping in long-term care facilities? I understand that we have to wait until the provinces formally request such assistance, but what are you, the federal government, doing with the Canadian Armed Forces? How can you help the provinces with their long-term care facilities and assisted living facilities? Answer, Minister Duclos. The Canadian Armed Forces can help in a whole host of ways. Prime Minister Trudeau said today that the Rangers are hard at work in Canada's north. They are helping out logistically. They are helping people travel and move around. They are helping municipalities. They are also helping out with safety and security in Canada's north, which is sparsely populated but has a vast territory. Now, as for medical assistance, as for the Canadian Armed Forces intervening to help medically, well, the Canadian Armed Forces can help out substantially when it comes to health. They would, if necessary, step in to support provinces and territories, but that would have to follow, as you've said, a formal request from Quebec or from a province. Philippe Vincent Foisy, follow-up question. Tangibly speaking, though, what could they do? And if Quebec, for example, requested that the Army step in tomorrow, could the Army then step in this week very quickly? Because people are dying now. Answer, Minister Duclos. We must work with provinces. Quebec and all provinces are working very hard to cope with the public health emergency that we are experiencing. And the situation is particularly dire in long-term care and assisted living facilities. We are trying to ensure that everyone receives the help and support that they need. And the Canadian Armed Forces are a support. They are there to help and support when the provincial government, so in this case Quebec, makes a formal request for the assistance of the Canadian Armed Forces. Thank you very much, operator. Next question. Thank you. Our next question is from Michel Lamarche, TVA News, TVA Nouvelle. Go ahead. Question. I have a question on the same topic, Minister Duclos. Can you confirm that Quebec has not formally requested the intervention of the Canadian Armed Forces? So, is it the case that Quebec has not specifically made a request? Answer, Minister Duclos. Yes, that is accurate. Now, talks are underway between the Quebec government and the federal government, and these discussions could potentially lead to a formal request. We will always listen to the needs and requests of the Quebec government. If Quebec requests assistance from the Canadian Armed Forces or from the Medical Corps of the Canadian Armed Forces, then that will be possible. Answer, Minister Freeland. I would like to restate that we have not received such a request from the government of Quebec. Follow-up question. This question is for Dr. New. Dr. New, we know that the science is constantly evolving when it comes to the usefulness of wearing a mask. Where are we now? What is our stance now on wearing masks, especially for the general public? In the upcoming weeks, will Health Canada or the Public Health Agency of Canada require that Canadians wear masks when they leave their homes? Answer. Dr. New, thank you for this question. This is a live issue, a dynamic issue. It's constantly evolving. Dr. Tam and I, a few days ago, had a very good conversation with the other members of Canada's Special Advisory Committee on COVID-19. When it comes to non-medical masks, for the general public, we have to, in fact, distinguish between non-medical masks and medical masks. Medical masks are essential PPE for healthcare workers. As for the general public, our stance is that wearing a mask is fine. Now, we have advised that Canadians only leave their homes when it's absolutely necessary to do so. And when Canadians go somewhere where it is not possible to practice physical distancing, for example, on public transit or at the grocery store, then wearing a mask is a good option, yes. But when we wear non-medical masks, we are protecting others. When we wear non-medical masks in public, it is because that is an action that we can take to protect others. However, these non-medical masks do not protect us from others. So our stance has not changed in that sense. Thank you, Doctor.
Okay, we'll turn to the room, starting with Julie, CBC.
Julie Van Dusen, CBC. Dr. Tam, when you said the epidemic is slowing down, my ears kind of perked up, but is there any reason to get optimistic about this when it doesn't sound like there can be any change in behavior?
Yeah, I think what I said was cautious optimism. I think what we're doing is working, and you're seeing that slow down. But I didn't say we reached the peak, and I've always said on the other side of that peak, you have to be really vigilant. If you do not, then you experience a resurgence. We've got many challenges still to deal with, including managing the outbreaks in long-term care facilities, etc. So I do think that the epidemic growth rate has slowed for sure. But the main message for all Canadians is actually not to let go. Lâche pas la patate, comme je dis avant.
Let's never give up.
This is not the moment to let go. You're doing a great job. Let's continue that until we can get to the bottom of that hill and then look at what that new normal would look like.
Okay, and I guess my second question would be for Mr. Duclos, or perhaps the Deputy Prime Minister. We talk a lot about nursing homes, and it seems to be a lot of talk and not a lot of action. Canadians are devastated by what's going on in there, especially those who can't visit their loved ones. We all know that we would never let a pet suffer this way, much less a loved one. So you call it a war, and a lot of people are wondering, where are the soldiers? Why don't you send them in? Perhaps with the help of the Red Cross on a humanitarian mission to serve meals, to help out just during the pandemic. What kind of possible bureaucratic excuse could there be not to?
I'll start, and certainly the Deputy Prime Minister could add if she wishes more. I first of all agree with your assessment that we have to do a better job collectively as governments, and I think this is no secret to people, as I said yesterday, who have experienced a loved one who's lived in long-term care. There are a variety of different levels of long-term care, but some of them are quite atrocious, as you pointed out, and I think this is an opportunity for all of us at all levels of government to reflect about how we will do a better job. In terms of our immediate response, I've had conversations both with my both counterparts, Minister Elliott from Ontario and Minister McCann from Quebec, to talk about how we can support them in the short term, including as we've mentioned, resources to top up wages for long-term care workers so that they have what they need to stay in one place and not have to work in multiple places over multiple sites, but also in helping them with the significant human resources crunch that they're facing right now. And so Health Canada has, as I think I announced a couple weeks ago, a portal that thousands of Canadians have applied to help. And so we are working closely with both Ontario and Quebec to match them with the appropriate resources to support them in long-term care homes and other ways that they might need within the healthcare system. And in fact, just checked with my deputy, and there's about 1,000 people right now that would be available to support Quebec that speak both official languages. So that work is happening right now. And I think there's two stages. There's a short-term stage, which is doing what we need now to actually put the tangible pieces into place that will protect people living in long-term care homes, but also people working in long-term care homes. And then secondly, how we work together to build up a much more humane system for all people who are aging in Canada.
Okay, Marika?
Marika Walsh with the Globe and Mail. I'm just wondering, this is either for Dr. Tam or Minister Hajdu, how many warehouses or stockpile locations do we have for the National Emergency Stockpile across Canada? And how has that changed, say, in the last 20 years? Has it gone up or down?
I think I'll turn that to Dr. Tam, as I, believe it or not, before the pandemic was the Minister of Health for a month and a half, so I don't have the history that perhaps you're looking for, so perhaps Dr. Tam does.
Yes, so I think in the past decades, the NES actually stockpiled a lot of things like cots and blankets and that type of material. Those were sort of reduced over time because other people can provide some of those, but we still deploy them. And they are scattered across the country. And we have at least 5 regional warehouses for general supplies. But the national stockpile over the years has been much more focused on stockpiling very strategic medical supplies that nobody else actually holds. And those are very specialized, and it's held in one single warehouse, basically, where there's very specialized conditions to maintain those medications or vaccines.
So can you just confirm, does that mean there are a total of 5 warehouses in Canada, and what was the highest number? And my follow-up question is on CBC's reporting that the warehouse in Regina was closed and that masks were thrown out. Were those masks replaced, and why was that specific warehouse closed?
I asked my officials that question this morning when I also read the story about the destruction of expired masks in the Saskatchewan warehouse. And we'll be reviewing the practices of what we do with equipment that is near to expiry, because I believe there is probably a more effective way to use equipment that is nearing its expiration date. Certainly that was pre-pandemic, and I understand the reluctance of Public Health Agency of Canada to distribute equipment that in any way has expired in normal times, because of course the first focus is the safety of the people that will use that equipment. But there may be opportunities to, and I'm certain actually there's opportunities to look at a process where that equipment is offered either first of all to parts of Canada that may not have easy access to that equipment, and if not, then overseas to other countries that may need it. So we'll be reviewing that practice.
Okay, it's 5 warehouses?
The
clarify that, because even for me, some of those changes because of logistical requirements, but definitely confirm that.
Thank you, Doctor. Annie?
If I could just ask and one more thing. When I asked about the nature of the warehouses early on, I will say that they are considered to be an issue of national security. So releasing the exact location of warehouses is not a practice that the Government of Canada has ever had, because, of course, these are strategically important resources during times of pandemic or other kinds of disasters.
Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Dr. Tam. The percentage of people who were testing positive seems to be increasing. In the first week of April, we were around 3.5%, and at that point, you said that was a good range for Canada to be in. Now we seem to be hovering around 6%. I'm wondering what attributes for this change in the percentage and whether Canadians should be concerned that more people appear to be testing positive for the coronavirus.
Yes, I think the percentage positive is a combination of different factors. One is how the provinces are targeting the testing. So obviously targeting high priority situations where there are outbreaks, that will get you more percentage positive potentially. But what we want is a sensitive enough system where significant numbers of people perhaps with milder symptoms are still being tested. So you still have 94% that are not positive. So it shows that the country is still testing a lot of people who in the end didn't turn out to be positive, but that shows a certain amount of sensitivity in the system. But that's also a composite of the country. So those might be different depending on the location or the jurisdiction because of the different epidemiology as well. So it's a combination of things. I think globally, what is suggested is anywhere between 3 to 12% is the sort of range that people have been using as a system that has a sort of right balance of targeting the right population, but also being sensitive as well. But we, as we've all said, we need to improve the lab capacity in Canada, and we're going to continue to do that.
Okay. As a follow-up, every day it seems like we're hearing more cases of healthcare workers who are being infected. And I'm wondering, one, if you have an exact picture of how many healthcare workers across the country are currently infected. And two, what is the federal government doing to ensure that hospitals have the staff they need as more healthcare workers get sick, and the same goes for long-term care facilities?
Well, first of all, and I'll turn to Dr. Tam to speak about specifics in a minute, but I will say that the work that we do at the federal level around staffing of hospitals and process and protocols for hospitals is at the technical guidance level. Dr. Tam and Dr. New, as you know, sit on the Special Advisory Committee, which is comprised of all of the public health officers from across the provinces and territories, and it is there where the guidance gets developed in partnership with all of those experts across the country. The federal government has provided a number of resources. I always say that we are able to provide money, which we have, to provinces and territories. We are able to provide equipment, which we have, to provinces and territories, and guidance. And that is really the role of the federal government. And of course, any other extra special requests that each province and territory poses, like, for example, human resource support, we are working very diligently to provide that as well. I don't know if that's complete enough, but I can certainly give it to Dr. Tam to speak a few extra words.
I think it is actually quite important to look at the number of cases in healthcare workers, which the provinces have much more detailed information on. Of the provinces that have provided us with information that we can glean, the percentage of cases that have been in healthcare workers ranges somewhere between sort of 7% to sometimes 11%. In general, and the exposure setting, if you like, is actually quite varied. A lot of them are actually infected not at the workplace. Sometimes it's due to travel, attendance at a conference, attendance at certain mass gathering events, and certainly into the more social context as well. So I think what that tells us is, of course, we need to protect healthcare workers, both at the workplace, but it is also important for them to reduce all of their risk of acquiring infection elsewhere, I think, as part of their other daily life as well. So I think both aspects of protecting healthcare workers are important. Of course, travel and mass gatherings have now been considerably reduced. I know of even one cluster where it involved a funeral setting where there were some healthcare workers as well. So it's actually quite varied in terms of where they acquire infection. We know today of one health worker who had unfortunately died with COVID-19. It is unclear, I think, where that worker, who is, I think, an environmental staff, had acquired infection. It may not be the workplace, it could be in the community, but that's sort of under investigation by the jurisdiction itself. So I do think that this is something that we are monitoring, I think, in every area of Canada very closely.
Thank you, Doctor. We'll now turn back to the phone for two last questions. Operator.
Thank you. Our following question is from Jim Bronskill from the Canadian Press. Please go ahead, à vous la parole.
For Dr. Tam, it seems many say that a rapid testing capacity that's many times what we have in Canada right now is a requirement for a return to anything like normal. First, do you agree with that? And if you do, can you lay out in detail what's being done to get us to that point?
So I think certainly when there are bigger outbreaks or clusters, you can be what you're testing is trying to determine if an outbreak is occurring, and looking at community transmission. When we get to epidemic control of the first wave, which is our collective objective and our goal, you have to have sensitive laboratory testing. You have to have good testing systems so that you can detect any reigniting, if you like, and the sparks and clusters reoccurring. So for sure, ramping up our capacity in anticipation of that period of time where we had to detect further chains of transmission is very critical. So we are doing this in a number of ways. One is every single day looking at every avenue to increase our capacity to do the detection for the virus, which is mainly the PCR test. So those are the tests that could be done in bigger laboratories, but also smaller ones, but then the rapid test that can detect the virus as well. So absolutely pursuing that, including, of course, domestic supplies, such as the Spartan company that is providing, this is one that Health Canada had recently approved. So trying to get as much of that diagnostic on board, and that would be really a sort of great component of our strategy for those who are more in the remote and rural areas, indigenous communities, because that will eliminate the transportation time for any specimens. But for sure, any of those types of tests we're pursuing. Making reagents, ensuring we have swabs, all of those things are being worked on every single day by every laboratory. You know, we have to thank the laboratory people, by the way, today, and all that they're doing to help us in this outbreak. Also then, of course, we are examining the antibody tests. And people have asked us that, about that in the past. And we are actively testing some of those kits, doing quality assurance, making sure that they can actually detect antibodies, and then further understanding the immunology of the virus. So I think all of those streams of capacity building are relevant.
Thanks. And for Minister Hajdu, what do you make of the U.S. President's comments about the World Health Organization and the withdrawal of funding? How will this affect the fight against COVID-19?
Well, I think Canada values the work of the World Health Organization, and we continue to commit to contribute towards the work of the organization. It is a very valuable tool when in regular times, in both its ability to detect new virus activity, to manage outbreaks of a variety of different diseases around the world, to bring scientists and researchers together, to allow the capacity for countries to work together to deal with these types of outbreaks. And so we commit on a regular basis through the presence of Dr. Tam as one of the expert advisors to the committee, this special committee on COVID-19. And we know that any response to COVID-19, and in fact, really any global outbreak, is one where countries have the capacity to work together and to pool their research and to really share their efforts to manage these outbreaks that will happen again and again and again, by the way.
Thank you, Minister. Operator, next question, please.
Thank you. Our following question is from Lauren Gardner from Politico. Please go ahead, à vous la parole.
Thanks for taking my question. The Prime Minister said yesterday that border restrictions are going to be needed for weeks. Many states in the U.S. have extended stay-at-home orders. How long is Canada looking to extend the current limitations in place for non-essential people not crossing the border?
Thank you for the question, Lauren. Well, you will have heard from Dr. Tam and Dr. New that they are cautiously optimistic when they look at the doubling rate of coronavirus in Canada. And I would just like to echo their comment that Canadians have been great and really disciplined. And I am so grateful to Canadians for their excellence in committing to physically distancing, and that does allow us today to be cautiously optimistic. You've also heard from our public health officials that we recognize in Canada that we still have a considerable way to go, and we are going to be absolutely vigilant and fierce about not squandering the tremendous sacrifice that Canadians have made and not squandering what that sacrifice has accomplished. So, and I'm just so grateful to Canadians who have been so terrific, and everyone has made a sacrifice. And I'm really pleased in a cautious way that we are able today to say that we're cautiously optimistic. That is really precious. That is hard won. And as you heard from our public health officials, we are going to be very careful.
Okay, we are going to
thoughtful.
leave this federal briefing and the Deputy Prime Minister, Chrystia Freeland, but do let me reiterate the news that she's referring to there, that there is some cautious optimism that those strict public health measures of physical distancing and staying at home do appear to be working. Much time yet to go, as the Prime Minister said today, weeks still into this, but some optimism that the measures that all of you are taking at home do seem to be working. We're cutting away from that to bring you to Toronto, where the Ontario Premier Doug Ford is speaking. I'm Rosemary Barton. Andrew Nichols picks up our coverage. Thank you for watching.
And we owe it to our most vulnerable. We owe it to their families and loved ones to fight this terrible virus until the end. We owe it to them to leave nothing on the table, and today we're throwing everything we've got at our long-term care homes. We're mobilizing every available resource. We will stop at nothing to protect those who cannot protect themselves. Today, we're launching an all-out plan to fight COVID-19 in our long-term care homes. We will fortify the iron ring of protection around our long-term care residents and those who care for them.